So the marma, the energy point on the face as well as on the scalp, starts from Adipati Marma, which is the center of vertex, and we have given its anatomical position according to the previous dialogue. Then Brahmarandra, which is the place of anterior frontanel. Then beneath these two eyebrows at the center here, that is Thapani Ajna Marma. This Ajna Marma is connected or related to the pituitary gland, and Brahmarandra is related to the anterior cranial fossa as well as pituitary, and Murdni or Adipati is related to the pineal gland and pyloric valve. According to the ancient Vedic description, I am just using modern anatomical phrases just to convey the message. Then at the center here on the mandible, where two mandible bones are joined together, there is a Hanu Marma, which is related to the posterior pituitary, head cold, testicular and cervical pain. For that reason this marma is used. Then in between the tip of the nose and the upper lips, at the center of that, there is a marma called Oshta Marma, which improves cerebral circulation, and in case of syncope, transient loss of consciousness, if you give gentle pressure here, it improves cerebral circulation. That also we have discussed. Then on each side of the nostril, there is a Nasa Marma, which is used for allergy, bronchitis, bronchial asthma, and certain lung condition, because pressure here sends a message to the bronchial musculature and they relax, and there is a bronchodilation. So when person is in wheezing and sneezing condition, this pressure is very important. Then from the root of the nose and tip of the nose, midpoint, exactly on the wall of the cheek, midpoint of the nasal bridge, there is a Ganda Marma, and it is related to the paranasal or maxillary sinus. And if you give pressure here, it opens the sinus. So that's sinus congestion, pain in the sinuses. This is great, this marma. Then Chibuka, which is on each side of the angle of the mouth, that marma is quite fascinating. It is also related to the digestion and reproductive organ, both testicles as well as ovaries. Then one important marma on each side of the outer angle of eye, which is Apanga Marma. The right Apanga is related to the right kidney, left Apanga related to the left kidney, plus right Apanga is also related to the ascending colon and left Apanga with the descending colon, and it is also important to maintain the lacrimation, because pressure here sends message to these tear gland, lacrimal gland, and they stimulate lacrimation. So for dry eye or increased intraocular pressure, glaucoma, if you gently press here, it improves the circulation of vitreous humor, and intraocular pressure can be regularized, which is very fascinating, this marma. Similarly, on the medial side, there is a Kaninika Marma. This is related to the stomach as well as eye strain. In case of gastritis, that is why a patient of hyperacidity gets burning sensation in the eyes. Why? Because of this marma. So I just give briefly introduction to this energy point. Now let us go and try to share that how we can use these different marma energy point on hand-on practical work. I am using this sandalwood oil. It is balancing for Pitta dosha. If it is Vata dosha, I can use nutmeg oil. Nutmeg is tranquilizer. If it is kapha dosha, I can use vacha oil, calamus root oil. It is decongestant. So depending upon individual's vikruti, the disorder, whether there is excess vata or pitta or kapha symptoms, based upon that you have the choices of different essential oil. Sandalwood is very sane, benign and very mellow. It is tridoshi, but it is specifically good for pitta dosha. So I will just little bit apply sandalwood oil to the tip of the finger. Can you smell this? Good. So it also acts as an aromatherapy. Gently rub the hand and bring prana energy to the hand. And then put the hand gently on the face. As you are doing this, you pay attention to the breath. And slowly move the hand to the ear and close both ears and just give upward pull towards you. And turn the head to the right side. Gradually turn the head to the left side. This turning or shifting the head to the right and the left pulls the trapezius muscle. And trapezius muscle is a muscle of responsibility. That's why people who carry whole world on their shoulder muscles become tight. So to release that tension, you gently move the head to the right side, to the left side. Then lift the head and do little flexion of the neck as if the chin is touching the chest. And I am pressing my thumb on the topmost point, which is called Adipati or Murdni Marma. This is very fascinating. It improves cerebral circulation of the cerebrospinal fluid as well as cerebral arteries and veins. So when you pull the neck upward, head upward, it relieves the tension in the neck area. Then do little shoulder press. When individual is inhaling, relieve the pressure. And when individually exhaling, slowly press the shoulder. That way you are following the breath of the client. This way you remove the stress. Now client is ready.